Hey friends, welcome to my YouTube channel. In my last video I discussed about different types of cardiovascular diseases. Looking at the number of arteries present and the number of cardiovascular diseases, it is important to know why these diseases occur. Doctors currently treat the symptoms of these diseases. Let's see how these cardiovascular diseases are treated in India. Okay. Let's begin the discussion. I am Dr. Balaram Dhotre, a researcher by profession and the author of the book, Unraveling the Root Cause of Chronic Diseases. Now let us look at the statistics of cardiovascular disease in India and the burden it imposes on the government. Can the situation be improved? Can we have a proper solution to these diseases? What can the Indian government do to improve the situation? Can we do something on our own? Statistics of CVD in India. Cardiovascular diseases in India are increasing due to the increase in the prevalence of CVDs and CVD risk factors. Reducing the risk factors is the strategy adopted to prevent and treat CVDs and not the underlying cause. Unless the underlying cause of CVD is targeted, it seems difficult to prevent cardiovascular diseases in India like coronary heart disease and stroke. Cardiovascular diseases, CVDs, have become the leading cause of mortality in India. This epidemiological transition is largely because of the increase in the prevalence of CVDs and CVD risk factors in India. In 2016, the estimated prevalence of cardiovascular diseases in India was estimated to be 54.5 million. 1 in 4 deaths in India are now because of CVDs, with ischemic heart disease and stroke responsible for greater than 80% of this burden. According to available data, in 2022, India saw a significant number of cardiovascular disease, CVD, deaths, with reports stating that around 32,457 people died from heart attacks alone, marking a rise from the previous year. However, precise figures for 2023 are not readily available, but trends indicate a continued concern regarding CVD deaths in India. These diseases tend to affect patients in the most productive years of their lives and result in catastrophic social and economic consequences. The burden of CVD risk factors. There are several risk factors for the rise of cardiovascular diseases in India. These cardiovascular disease risk factors are mentioned below. Smoking. Deaths due to smoking. It is estimated that, currently, 275 million individuals aged _15 years consume tobacco in India. The monthly burden attributed to tobacco in India is huge because it is estimated to cause nearly 1 million deaths annually. Consumption of fruits and vegetables. Indians are mainly vegetarian. It is expected that they may be eating plenty of vegetables and fruits. On the contrary, the survey shows that the rate of consumption of vegetables and fruits is low. This is due to the high cost of fruits and vegetables. In addition, the vegetables that are consumed are often overcooked in Indian meals. This leads to the vital loss of nutrients. Fat and carbohydrate intake. According to one survey, Indians' fat intake increased from 24 to 36 GD and from 36 to 50 GD in rural and urban individuals, respectively. The consumption of whole grain decreased and the consumption of refined grain products increased. Physical activity. Data on physical activity in India are sparse. We can say that physical inactivity is more in India. Hypertension. The prevalence of hypertension in adult Indians is estimated to be 30%, 34% in urban areas and 28% in rural areas. The number of people with hypertension is expected to double from 118 million in 2000 to 135 million by 2025. Diabetes. India is considered the diabetic capital. It is estimated that the number of individuals with diabetes mellitus will increase to an alarming 101 million by 2030. Cholesterol. Serial epidemiological studies in India suggest a rapid increase in the mean levels of total cholesterol, low-density lipoprotein cholesterol, LDL, non-high-density lipoprotein cholesterol, and triglycerides. In the ICMR India study, a large proportion of people had at least one lipid abnormality. Only 20% had all lipid abnormalities, TC, LDL, HDL and TG, within the normal range. The most commonly observed abnormality was low HDL levels. Conclusion. I would like to conclude this way. The cause of cardiovascular diseases is attributed to several risk factors. This is nothing but association theory. Almost 65 years have passed ever since the association theory was established. The diseases are on the rising trend only. The situation is very grim. In the next video, I will discuss the efforts taken by the Government of India to prevent cardiovascular diseases by taking steps to reduce the risk factors. And also see what the results are. I hope you liked my video, The Cardiovascular Disease in India. If you liked my video, click the like button and subscribe to my video. Thank you for watching my video.